The head of the World Health Organization has warned of moral failure as the coronavirus vaccine rollout favours wealthier nations. Joining us live now is Dr. Margaret Harris from the World Health Organization. Doctor, good to see you. Thanks for joining us this morning. So the quote is that the world is on the brink of catastrophic moral failure. Why is that?
So what my Director General was saying is that we have this set up. We set it up months and months ago because we knew that with a crisis like this, the instinct is to try to grab something that looks like a lifeline and just use it on your own people. But it makes no moral sense because we need the world to work together. It also makes no sense in public health terms. It makes no sense in economic terms. We really need to vaccinate the most at-risk groups all at the same time, all around the world. But unfortunately, that sort of reflex to grab it all has been demonstrated in some of the wealthier countries. So the COVAX facility we set up to enable that vaccination to happen in every country at the same time is at risk of not having the doses of vaccine that we need to roll out to all the other countries that don't have the wherewithal to get vaccines themselves.
Well, why is it so catastrophic?
So this particular virus has gone everywhere, as you know. And until everyone is protected, no one is protected. But also, to really take the pressure off, we need to get healthcare workers vaccinated. We need to get healthcare workers vaccinated everywhere. They're the ones that are fighting the fight for all of us, standing between all of us, between life and death. And that matters in every country. We also then need to get the people who are most at risk of getting very severe disease vaccinated. And those are the people who are older. Those are the people with underlying conditions. Now, after that, the rest of the population. But we need to do those top, most at-risk groups. We need to get them vaccinated first in every country.
But what are you suggesting happens if those poorer nations aren't vaccinated, before wealthier nations? Does the virus then still breed and I guess, can result in more waves?
Exactly. So we've seen with this virus, it's beginning to change as well. The longer you let it stay in populations, the longer you let it transmit, the more opportunity it has to make itself very comfortable in our bodies, in our populations. So we need to do this together. It makes no sense to just say, oh, my country only. We are not in a world where that makes any kind of public health or economic sense. So even though you can understand leaders wanting to look after their own people, that's what they've been put there for, in terms of the human population, we have to look beyond our borders and really do this in a concerted world solidarity, all those positive things. Even if you didn't care about your fellow man, it makes no sense not to care about your fellow man.
Yeah, you referred to this just there. Governments and countries are going to look after their own people first. That's kind of why they're elected. They've got to do that. So you can't begrudge governments too much for taking that approach.
So that's why we're saying, yes, do look after that most at-risk populations. We're not saying don't vaccinate your people. We're saying vaccinate the at highest risk groups that we've identified. So vaccinate your health workers, vaccinate your older populations, but don't go and vaccinate everybody thinking that's fine, hey, job done, because job isn't done. Yeah. You want to make sure that vaccination is happening everywhere, and then we've got a better chance of saying job done.
Just onto the links over the last couple of days, Doctor, in Norway, the dozens of deaths there that had been linked in some way to a vaccine. What's your official take on that?
So this is another very important part as people roll out their vaccination programs. It's crucial that they be planned so that any kind of adverse effects, including, of course, the worst adverse effect, potential deaths, is looked at and understood. So in Norway, they've looked at people who were vaccinated and died within a period after the vaccination. They had been vaccinating very, very frail elderly people in care homes. Now, unfortunately, people in those groups do die of a lot of different things. And so far, the information we're getting from Norway is it does not seem that it was specifically causally related. In other words, the vaccine didn't make them die, but they are looking at those groups and saying to their medical advisors, do consider whether or not it's appropriate to be vaccinating people who are already very ill.
So you're not too concerned about that. You believe that shouldn't affect confidence, particularly in those age brackets, that shouldn't happen, that people shouldn't be too worried about it.
It's certainly very important that this information is shared, and this is a great example of good information sharing. So the information that comes from Norway is something that the Australian authorities would look at and take into consideration when they're planning their vaccination. And this, we ask that every country looks at exactly what's happening and reports it transparently so that we can all share and learn. And if there are any signals that are of concern, we all know about them early.
The Australian rollout of the vaccine, it's starting next month. It's a little behind other countries such as the US and the UK. Do you support that? Or do you think Australia could be moving a bit faster?
Australia has the luxury of having managed its outbreak very well and kept its transmission rates down. And again, the important thing is that Australia, like other countries, vaccinate the most at-risk groups. So the healthcare workers, because even though you've done very well, they are still dealing with people who are sick. They are still exposed to people with coronavirus every day. So they need to be vaccinated. And again, your older people are the ones most likely to get severely ill and to need care. So they are the groups you should be vaccinating. But certainly Australia has the luxury of being able to take your time and plan well and do it well.
But